Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what laser ablation is, its history, how laser ablation works, how effective is it, who qualifies for laser ablation, benefits, and risk. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified about future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. According to the University of Utah, laser ablation is an alternative to invasive procedures like craniotomies. Laser ablation is a common procedure for patients with medically intractable epilepsy and can eliminate problem areas in the brain with minimal inconsequential damage to the surrounding brain tissue. The goal of laser ablation is the following: reduce the number and severity of seizures or get seizures under control. For patients with obsessive compulsive disorder, in which medication does not work, and for patients with tumors, they use laser ablation to destroy them. The first developments of stereotactic ablasive techniques dates back to the 1960s, with significant progress made through the 1990s. Radiofrequency ablation was subsequently developed and integrated into surgical practice. Today, the use of laser interstitial thermotherapy is an increasingly common procedure for patients with medically intractable epilepsy, as this technology can eliminate problem areas in the brain for epileptic patients with minimal inconsequential damage to the surrounding brain tissue. Patients are put under general anesthesia. Once under, the surgeon makes a small incision in the skull about the size of a pencil and places a guided laser probe into the brain. Magnetic resonance imaging, MRI, is used to map out the area to target the location where seizure activity is taking place. Laser ablation technology uses short wavelength radiation against somatic tissue. Essentially, a laser beam is directed towards a mass of tissue and irradiated, and that tissue is converted into a high-temperature plasma that dissipates. During lit procedures in epileptic patients, a laser beam ablates the portion of epileptogenic foci that acts as the starting point for epileptic activity in the brain. After the procedure is completed, the surgeon will close a small hole in the bone and stitch the incision. Patients spend 1 to 2 nights in the hospital, depending on how they do. According to Kane and others, key findings found during a study showed that verbal learning and memory performance were only minimally affected. Contextual memory was adequately preserved, and the population in the study showed a 53% remission rate. Risk observed during the study included lower odds of controlling seizure activity compared to open surgery, a decline in contextual memory task, seizure relapse, headaches, insomnia, mood symptoms, and scalp numbness. One patient experienced an adverse side effect of brain edema with hemorrhage in close proximity to the ablation site. Challenges within the study include challenges with gathering long-term data and having a limited population size. The following patients are eligible for laser ablation: individuals with uncontrolled seizures who have not responded to other therapies, medications, and dietary changes, brain tumors that are causing seizures, seizure activity deep within the brain where neurosurgeons cannot operate using traditional surgery, treatment-resistant OCD, small lesions or specific areas in which seizures occur, hypothalamic hamartoma, tubercular sclerosis, mesial temporal lobe epilepsy, and cortical dysplasia. The benefits of laser ablation include less invasive and safer procedure compared to an open brain craniotomy, lower chance of damaging healthy tissues during surgery, shorter surgery time, smaller incisions and holes in the bone, no need to shave surgical site, less scarring and pain, can treat areas deep within the brain, shorter hospital stay, quicker recovery, fewer complications compared to traditional craniotomies. The following are risks that can take place during laser ablation: narrowing vision, bleeding in the brain, nerve damage, and infection. In conclusion, according to the University of Utah, laser ablation is an alternative to invasive procedures like craniotomies. Laser ablation is a common procedure for patients with medically intractable epilepsy and can eliminate problem areas in the brain with minimal inconsequential damage to the surrounding brain tissue. Surgery will only be considered if medication and dietary treatments fail. Benefits include laser ablation being less invasive compared to an open brain craniotomy, lower chance of damaging tissue, quicker recovery, and fewer complications. Risks include narrowing vision, bleeding in the brain, nerve damage, and infection. Consult with your physician to see if laser ablation is an option for you. To learn more about laser ablation, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.